I was talking to some of the citizens in line earlier, and you had somebody from the Eastern Shore who was here getting the vaccine, and of course Baltimore.
Well, that's good. I'm glad we're getting some folks from Baltimore in. You know, I think at Prince George's we've done all 24 jurisdictions. That's amazing. People are coming from everywhere to get the vaccine. This should be.
You know, the other thing that this will allow, Governor, is to think about the resource and access point. It allows us to think about focus of city focus, vulnerable populations, you know, where we can.
Good idea.
So it really does.
Good idea.
Opens up opportunity.
Yeah.
All right,
Do you want to
Dr. Marks.
see the
Dr. Mark, let's
the
go.
arena here? So we already
Very much. Good morning.
hello.
Wow, this looks nice.
Plenty of people in the queue. We're not serving any beer,
No.
no sandwiches, but
Well,
vaccine.
that's, maybe next time. Hello, folks. Good morning. I'm glad you're getting your vaccine. Are you excited?
Yep.
Are you a little nervous? It's not even going to hurt.
Okay.
It's going to go great.
All right.
Good luck to you.
Thank you. Good morning.
Good morning. How are you? Nice to see you.
Thank you for coming out.
Beautiful place here. It's going to go very smoothly. Hi, guys. Hey, yes, that's you.
We're happy to have you
We're
here.
proud of that. I'm glad to see you all in here this morning. Good luck. Good morning.
So folks check in here using the iPads.
Good morning. How are you?
I get a picture with you.
Okay, come
I
on.
want to thank you so much for everything.
Well, thank you. I'm excited that you're here this morning to get some of the very first shots at this facility. It's going to be terrific. It's beautiful. I was kidding that we can't get a hot dog or any snacks yet, but maybe we'll work on that. It's great.
We're working
You
on
can
it.
get a vaccine.
A hot pretzel. You want a pretzel?
Hey guys, good morning. How are you?
Good, thank you.
Nice to see you. Thanks a lot. Appreciate it.
How you like your National Guard site? Pretty nice.
It's pretty darn nice, yeah.
I'm sure that was the first thing Janine told you when she got here. Said, "Sir, this is Air National Guard."
That's just air guard. She didn't really say that, but I didn't wear my bomber jacket today.
Let me introduce Dan Williams, Director of Community Health.
I know, I'm gonna hurt you.
From the beginning, her brainchild was to create a solution like this.
Well,
And then it
thank you
just
for
been,
all your
sweat equity has been amazing.
It's been a team effort. It's a huge
We don't want to hold up the line. I see people standing here. The vaccines are more important than all this jibber jabber. And we don't want to slow anybody down, but it's nice to see you all this morning. Good luck. I know it's gonna be a good feeling when you get that shot.
It's a pleasure.
Very nice to meet you too. Guys, I'll take a beer and a hot dog, pretzel.
Excuse me. Folks are getting vaccinated here along the left.
Sure. I want to see if he flinches. You're pretty tough, you guys.
I feel like it.
So here's your card that you have to back, and this is the time that
Take
you're
good
going to
care
leave
of you.
back there. All right? Thank you very much. Thank you. You have a great
Congratulations.
day. Thank you very much.
Thank you both very much for all your hard work.
Yes, sir. Thank you.
Appreciate all of it.
So is it okay for me to use a picture with the boss?
Hi, lady. Sure. How are you?
Good. How are you?
Nice to see you.
Nice to
It
see
is
you as well.
really funny with the beer taps here.
Yes.
I've never been in
Very.
the stadium when I came up here and didn't, get a vaccine instead of a.
Right. So can you turn around and get a picture?
Yes.
Will you
Come
take
on,
a
let's
picture
just
with
do
me?
that. Okay, you guys coming off.
I want to get in this one.
Yeah, come on.
Okay.
Everybody in there? Looking good? Looking good? Yeah, we got it. Look right, this beautiful lady right here. Thank you.
Thanks, guys.
Good to see you all.
Good morning. Thank you both very much. Thank you for all your hard work. It's going to be exciting. We're going to thank you so much for everything you're doing. Good morning. Oh, here. I'm sorry. We're in her way. Come on, please. Come right over. Don't let these guys make you nervous. Good luck. It's going to go great. Wow, this is.
We can
Good morning.
this up over the next week or so.
Well, so
To thousands.
yeah, we're we're just getting, we're going to have meetings tomorrow to determine, I don't say too much with those meetings, but we could easily say to you quickly, like, let's not do 2, let's do 4.
All right, so take a look around.
Like faster than we had imagined.
Yeah, so look, I mean, so this is built to scale immediately. You see this, right? So the soft launch, 250 people today is really taking a very small piece
Of course.
of the puzzle that we've set up. So I think we're ready and excited.
Yeah. Well, that's terrific. We're going to need the volume to roll out because as they increase the supply and as J&J comes out, we start to get more out there. We want to ramp, quickly. We don't want them sitting around.
Yeah, no, absolutely. We're on the same page.
And you can go fairly quickly. You can double that, but you can get to 10,000 if we get the supply.
So the other thing that we have, that Dr. Marks and team organized from the beginning is the ability to flow, right? So the first few weeks, it's first,
Yes.
then it's going to be first and second dose, and then the entire flow for how to manage that, which would be, I think, again, another real capacity.
Yeah. Well, that's gonna, so that's a whole different dilemma there.
Well, but it's one that's already been thought through.
Yeah, good.
So that's good.
I'm glad you got smart people doing all that.
Well, and also the vaccines.
Well, no, that is the case.
We want 3 vaccines at the same time, operationally, right through here with everything.
That's very, very good. And with the bigger bump that we're going to get, right, 20 million, by the end of March, is the J&J, which is one shot, which changes things also. Because
It also
That'll make it more efficient.
yeah,
Just keeps moving people through.
yeah.
And then you're able to refer people immediately down for an appointment at a tent, right? Because they don't have an appointment, they walk in.
recognizing again different access, and then other piece of
Yeah, no, that's good. That's good.
communities.
Yeah, that's very good. Yeah, good plan.
And our call center can reach out to people as well. So you can
No,
talk to
that's
So we can go back out. It's not just receiving.
That's terrific. Yeah. Good morning, ladies. Thank you. Yeah, really cool. When did you guys first start working on it?
Well, I think discussion started in the last couple of months, but really the plan came together in 3 weeks. With Tim and his team and Guard and Owens working together 7 days a week for 3 weeks. We got it together. So, really amazing. Great team.
Well, I'm excited to see it fully
Right, I
operational.
know.
I want to come out, this is a nice soft launch, but I want to come back when it's jam-packed.
An appetizer. This is an appetizer.
This young lady's getting ready to get her vaccination.
I know, right? You're watching.
Getting the shot, I get all these people
I
watching.
know. Good thing I'm used to being a performer, being on stage.
Yeah. You're not even going to flinch. She's going to do such a good job that you won't even feel that deal.
No pressure.
No pressure.
I put pressure on her.
Sure.
It's really efficient and well put together, and that inspires confidence.
It also is just a beautiful facility to do it in. A lot of them are doing it in big, empty auditoriums or parking lots. But this looks like it's kind of like very comfortable in here.
And the stadium, absolutely is a big part of this entire partnership.
Yeah, absolutely.
We do our part.
Well, you got a nice place here. I'm just disappointed you don't have the snacks.
Okay. He's throwing down the gauntlet.
Donuts in the morning. Some pretzels and hot dogs at lunchtime.
So
Major Fink is a big part of the process.
Thank you very much. Appreciate your efforts.
Thank you, sir.
Good morning. How are you? Nice to see you. Nice to see you. Thank you, guys.
This is a great example of the partnership.
Yeah.
I represent the Department of Health for you. Major Fink is my XO, and we're in tandem on everything, and that keeps lots of communication efforts. So
That's
it's been an
terrific.
excellent
It's
partnership.
a great partnership with everybody involved, with UMS and the Guard and the Health Department and the Stadium Authority. It's just terrific, everybody coming together for such a critical life-saving effort.
Well, thanks for the vision to just get to yes quickly.
Team, let's get to whoever needs to be on the, come on, Jeremy.
Come on.
Over here.
Can you see over me?
Sir, can you back up just a little bit? No problem.
Thank you so much.
Those are, hopefully the call wasn't very long. Thank you very much.
Go with the observation. So after
Good morning, guys.
vaccinated, they said.
This is monitor second doses. Very, good graphics. Easy to understand. Good to come in. I think it gives a sense of confidence.
Okay. It's really organized.
And then folks here have gotten their vaccine, they're scheduling their second appointment, and they sit for 15 or 30 minutes.
That's great.
If you want to.
Yeah, let's so how did it feel?
Feels great.
It feels great to have it. It didn't hurt, right?
No, not at all.
Well, congratulations. Keep an eye on you for 15 minutes. Everybody looks good. You guys good, okay?
Yeah, thank you very much.
How did it feel?
It didn't hurt one bit. It was great.
I'm so happy. I mean, this has been a struggle just getting enough vaccines, but it's really going to ramp up around the facilities, and we're starting to get more. Good morning, folks. Thank you for all your help. Hi, how are you? How did it feel? Good to go? Get the second dose scheduled? Good morning. Yeah, I already saw you. Good morning, sir. How are you? Congratulations.
Hey, how you doing?
How you doing? Okay?
I'm doing well.
Ready to schedule that second one?
Yeah. Hey, thanks for working on getting a better way to get people appointments.
This
Glad to
is
see that.
getting much more organized. We couldn't do appointments because we didn't have any vaccines.
Yeah.
Now we're getting both. So
Yeah,
we got
it's
the
doing
facilities. We're starting to get more supply, and it's
Yeah.
going to go much. This month
Really-
of March is going to be incredible.
Great, thanks. Sure.
Good morning.
You can work, yeah.
How are you, sir? Nice to see you.
Okay, sir, real quick, we wanted to see if we can get a picture with the I got vaccinated sign down there.
Yeah. Well, first, I got vaccinated.
Straight ahead.
Okay. Yeah. Get the team photo there. Sure.
State colors. Perfect location. Perfect facility.
Oh, and when the volume starts rolling, we're doing thousands. You got it's kind of move.
We even had it.
Let's get the team over here.
Great shot, sir.
Let's get another team. Let's get all the team leaders over here for a shot under this great sign. Come on, guys. Mohan. Come on, General. General, come on in here with us. Come on, Mohan.
You got it.
All right, everybody looks right here.
They're not
Super, thank you
socially
very much.
distanced. I
I
can
know,
tell you
they're
that.
not socially distanced.
Neither are we.
Super.
Yeah, we're all smiling.
That's right.
Sticking my tongue out.
Thank you very much.
Ravens. Wait. This is going to be a championship team here. That's right.
Did you get it?
All right. You know, we're going to play like Ravens.
There you go.
Vaccinate like Ravens.
Yes.
Thank you guys very much. Appreciate all your efforts. It's really pretty incredible. So you can't buy jerseys or hats or anything like that.
No, we're
Karen, nice to see you get out of the office every
Yeah, it's
once in a
great.
while, you know?
Take a nice little walk
Long
over
time
here.
no see.
Just wanted to see how you doing.
How's the Mohan treating you? Pretty good?
Very good, sir.
Let me hear that answer. Let me hear the answer. Get that on tape, please. Somebody.
Funny. Oh, he can't be a stuffle boss. He's the one you used to have.
Notice
I'm not
the
saying
silence. Notice the silence.
I should have had her trained pretty well for you because I roughed her up pretty good. We got some more we worked with.
Yeah. I know.
I did your home one time.
Okay.
Just head back the same way.
And we are taking it. You know, I don't know, I'm sure that subject will come up and we'll hear that.
Governor, let me introduce Dr. Chaudhry. He's a medical director.
Hey, Doctor.
How are you? Good. Very nice to meet you.
All the effort and all the work.
Oh, absolutely.
Very exciting.
Definitely appreciate you taking the
You
time
know
to
General
come down
Burka?
Hi,
here.
nice to meet you.
How are you?
He's in charge of our equity efforts statewide and trying to get more shots into arms for people who really need it. So it's a great team effort with everybody.
All right. Thank you. Keep going. So we've even reached out to an engineering professor at College Park. He's working with nine studies on Saturday.
Good.
So I'm gonna have them on my Tuesday.
Okay.
These are all the pharmacists.
Okay.
Say hi to the governor.
Hi guys, thank you very much. We appreciate all of you. Thank you.
All right. Probably, I think so. Same methodology and
Yes,
just make sure
exactly.
it withstands scrutiny.
And then right, that's right. And then we look at data.
Yes.
At the end of the day to
Yes.
inform us.
Exactly. Yes, exactly. It will drive actually. It's okay to have something you don't have to do that.
More importantly, how are you doing? Doing great. You've been working hard. You know, we're 3.1.
It's
Part of that's
Transmission rate is down.
Spring is here. But even what we did in the spring, when you shut down and you
Thank you very much, ladies. Appreciate it.
Thank you guys so much. Thank you. Working through
yes.
You look a little nervous. It's not going to be bad, I promise.
No, it's not.
No, you can barely even feel it. And it's going to be a good feeling when you get it done. How you doing? How are you, sir? Good morning. It's a very smooth running operation. You guys are going to go through and it's going to be wonderful. It's not going to hurt. You're going to feel a sense of relief when you get done. Thank you for being here today. Thanks for getting vaccinated. Guys, thank you for all your help. Thanks for being here.
Thank you, sir.
Appreciate you. Here, let me get a picture with you. Come on, thank you. Come on up. Ma'am, can we? General? Yeah. Can we have
Good to see you, ma'am.
3, 1, 2, 3.
It looks like you guys are ready. You sent 10,000 people.
I think so.
We're trying, sir.
Yeah, absolutely. Let's get you.
Hi, sir. Good to see you.
Good to see you too. Health department's been doing an incredible job. Guard's doing a great job. It's a really terrific team effort.
Thanks, sir. Thanks, sir.
Thank you guys for working so well together and working so hard.
Appreciate it.
Who are you giving to point out?
The two general officers over there, they need attention. Because they're hiding. Like, that's my team, right? I cannot. Yeah. Get over here.
Some guys hiding. Come on. We all have the same haircut.
I stay in the back.
Oh, wait a minute. Can we go move in front of the flag?
Oh yeah, the flags. Yeah, that's good.
Actually better.
Would you guys get in between the general and I?
Yeah.
We'll put them in the middle.
I got more of a face for radio.
Perfect. Thank you.
3, 1, 2, 3.
Thomas, you want pictures? So now they're starting to finally come in. They'll get scheduled right away as soon as we get them. We're about 2 million short on vaccines right now.
Okay, there's an awful lot of people spending an awful lot of time on the computer unnecessarily.
Yeah, I know. Well, you can't schedule it until you get a vaccine. That's the problem. You can't fix that.
Well, we'll continue.
Only the federal government does that.
We'll get it better. We'll continue to work.
Good morning, sir.
How are you? Nice to see you. Let me give you one of these.
It's a safe way to do the handshakes now. Good morning. How are you?
Glad to be here.
Well, I'm really happy that you are here. It's not even going to hurt. You're going to love it. You're going to feel good afterwards. Good morning. How are you folks? Good morning, sir. Good to see you. Good to see you too. Hey, guys. She looks a little nervous, but she's going to be okay. It's not going to hurt. Thank you. Thanks, guys. Thank you, sir. Hello, everybody. Thanks for joining. Limit the footprint as we're going in there. People getting vaccinated, but you should all have get all the details and the photos and the footage later. But we're very excited to be opening up our third mass vac site in the state here at M&T Stadium. Couldn't be more excited. This is somewhat of a soft launch today, but going very smoothly. Quickly going to ramp up to a couple thousand vaccines a day and over the next couple of days, and can do a capacity of up to 10,000 shots per day. So it's going to be a big boost for our statewide efforts. We're very excited about this partnership. A lot of people involved in making this happen in a very short period of time. But I want to thank particularly the University of Maryland Medical System. President and CEO Mohan Santha is here. Jason Marks, who has been in charge of this entire effort on behalf of UMS and getting it organized. Mike Friends from the Stadium Authority, who really was a great partner in helping us work out here. And General Janine Burkhead, who is heading up our equity task force. I want to thank the Ravens also. It's a great partnership between UMS, the National Guard, Maryland Department of Health, and the Stadium Authority, and the Ravens. And it's really going to be terrific. It's going to help us ramp up our numbers considerably. We're very excited about it. And I'll take a few questions in a minute, but first maybe Mohan, would you like to say a few words on behalf of UMS? Sure.
So Governor Hogan, let me start by thanking you for your leadership throughout this entire unprecedented challenge. On behalf of the 29,000 team members that define the University of Maryland Medical System, we're excited about this latest example of partnership, as this public-private partnership with the partners that the governor just mentioned has come together to serve the citizens of Maryland. This is a step in a big process to ensure that we create solutions that allow for our communities to be vaccinated. And on behalf of our health system, thank you, and we're excited to get this launched and get it going.
Thank you, sir. And General Burkhead, who's heading up our equity task force, has been doing an incredible job. I want to just ask you to say a few words about some of the progress and some of the things we're focused on.
Absolutely. So this is one step closer to getting us back to normal. I'll recognize this stadium, but also we have the convention center, giving Baltimore residents an opportunity to get the vaccine. So we're going to be very deliberate about making sure we do that. Across the state, I want to thank the partners and the counties for working with us. We are putting together plans to get out in the communities where people are. I want to remind you to please call 1-855-GO-VAX to make that appointment or get information. Remember to wash your hands, social distance, and get the vaccine when it's your turn. Remember that. Equity matters. Thank you.
Very good. Yeah. And Mike Friends from the Stadium Authority.
Well, we at the Stadium Authority are pleased to do our small part, and as we always tell the governor when we're asked to do something, we're here to serve. So, thank you.
Yeah. With that, we'd be happy to take a few questions.
Governor, with the J&J shot poised to be approved in the coming days, how will the single-dose shot change logistics of vaccines across Maryland?
Well, it's gonna be a real shot in the arm, so to speak. When we get that additional supply, our biggest problem, the problem that every state and every county and every city in America has had, is not enough vaccines. The third vaccine coming online hopefully will be approved on Friday. I think we're going to get guidance over the weekend, and we should start seeing those doses arrive in our state next week, which is tremendously exciting. It's going to add to the arsenal to go after this virus, and we're going to be figuring out exactly how many we're getting, and then determining with our team where those additional doses are going to go. But they're going to go in somebody's arm as fast as we can get them in there.
Governor, I have a question about the new scheduling portal that eventually all these mass sites will be under. What's the name of the company that's creating that for you? And can you comment on the changes to prep mod that are apparently coming to our state?
I didn't hear the second part. Okay.
The Montgomery County executive says he was told by the state that there's a prep mod update.
Well, Prep Mod is an old system that was just set up for normal flu vaccines. It was never intended to work for this kind of a massive undertaking. This is the biggest peacetime undertaking in American history. We've created a new site for all of the mass sites because we'll soon have 5 states that are doing state mass vac sites that are doing between 5 and 10,000 shots each, probably in the month of March. So it'll be more than all of the 2,300 locations are doing right now. So that one site will handle all of those reservations. We've also offered the software to any counties that wanted to upgrade their system to switch over from their own proprietary system or whatever they're using with PrepMod. So they will have that option, but it's going to help us get a lot more people scheduled. But the issue with that has not so much been a software problem. It's been we don't have vaccines, and you can't schedule an appointment for a vaccine that they haven't manufactured yet or allocated to us.
And I'm sorry, the name of the software or the
I'm not sure if anybody here has an answer to that question, but we'll follow up and get you that information.
Mayor Scott has said that he would like a certain percentage of vaccines at this site reserved for city residents. Is that feasible?
Yeah, I think that's one of the things that the Equity Task Force will be talking about. I know that the General is having discussions. We're talking about that with our partners at UMS. You know, as of last week, Baltimore City had gotten far more than they really were entitled to. We've got now 2 mass vac sites here. The city health department is only doing 14% of the shots here in the city. We're doing, with other partners, 86% of the effort. We have the vaccines here. We just got to get more people in these communities the vaccine, which is why we're going out into the community this weekend. The General and Lieutenant Governor will be out at churches in Baltimore City, and we're all focused on this equity issue. But Baltimore City, we've been doing everything we possibly can to help them. Our partners are trying to help them, and we'll continue to do so.
Can you talk about the advantages that this site presents in terms of access to people who don't have a car or can't?
Well, it is easily accessible, as is the convention center. With both UMS is our partner on both facilities. It's the only place that has 2 mass vac sites. They're both easily accessible for people who aren't going to be driving here in the parking lot. So that's a big advantage in addition to the mobile sites that we're going out into the community with.
Governor, since you and Mike are here, has there been any discussion about the beginning of the Orioles season, about getting fans back into the stadium and sort of getting back to normal?
Well, maybe, I don't know if Mike wants to handle that one, but we have had discussions. We're waiting, we're watching the metrics, we're talking with the Stadium Authority and talking with the team and Major League Baseball. Certainly our desire is to keep seeing our numbers trending the way they are and to try to find a safe way to get fans back in the stands.
If you could, what's it look like up there? I mean, when you go up
Yeah, I'm sorry everybody can't get in there because it's beautiful. It's really incredible, and amazingly organized, ready to handle and scale up the volume as soon as we get more doses. The people were very excited to be getting the vaccines. It's just a tremendous effort by all of the team members to get this thing organized, and it looks great. It looks like you're there to watch a Ravens game. When you go up to the bar, they have vaccines and pharmacists back there. It looks like the beer kegs are still, the taps are still there. And I said I was a little disappointed you couldn't get a hot dog and a beer, but they're doing a great job of getting vaccines done.
Governor, are you happy with the leadership now that's coming from Washington and the help you're getting from the federal government, or do you need more from the Biden administration?
Well, look, we've been working very closely in partnership with the Biden administration. I have a meeting with the president today with a number of people from the coronavirus task force. I talked to Jeff Zients personally yesterday at length. He's the head of the White House coronavirus team. And we're all in the same boat. They're trying to get more vaccines. They have slowly ramped that up. We're all excited about the Johnson & Johnson vaccine, the additional supply. So this is an all hands on deck effort. And we really all have to be working together at the federal, state, and local level.
Last question. The goal to ramp up to 10,000 shots a day, right? I think today we're between 250 and 500 shots. What's being done to make sure there's enough staff and manpower to support that?
Well, I'll let maybe one of these gentlemen, there's plenty of staff and manpower right now. They could handle it today, but today they're just working out, making sure it runs smoothly, like a soft launch of a restaurant maybe, is an analogy. But in a couple of days, we're going to be doing 2,000 a day. If we get more supply, we can easily ramp to 4 or 5, all the way up to 10,000 a day. But there were plenty of people in there today that could handle a whole lot, and they've got the staff already hired. All right, thank you guys.